Hello, this is Dr. Sima Aiden. Today I want to talk about autophagy or autophagy more in detail. And what is it and why should you care? Autophagy basically is the ability of every cell in our body to clean and recycle old and defective parts. Each cell in our body contains genes whose specific job is to perform these cleaning services. If you think of each cell in your body as though it were a washing machine, your body is a washing machine basically. These cleaning genes or autophagy genes are like the knobs on the washing machine. If these knobs don't work, the load of dirty laundry inside the washing machine or the cell parts won't get cleaned or recycled appropriately. The end result is a stinky load of clothes, and in the case of failed autophagy, basically dirty cells. So when was autophagy discovered? Scientists first had inkling about the autophagy in the 1960s when looking at the mammalian cells under the electron microscope. It wasn't until the early 1990s, however, that a Japanese scientist, Yoshinori Usumi, identified the genes essential for autophagy. Basically, he found the washing machine knobs. He was awarded a Nobel Prize in 2016 for his work. So how important is that your cells get cleaned and updated? If cells are not clean and parts are outdated, it can lead to cell malfunction and as a result, aging of the cell and start of the disease process. Okay, so now if your autophagy genes are mutated and basically the function of autophagy is poor, how that might affect your health. This type of autophagy has been linked to disorders of aging and elderly, neurodegenerative diseases such as Alzheimer's and other memory disorders, Parkinson, ALS, progressive supranuclear palsy, cancer, type 2 diabetes. But keep in mind, this doesn't mean that the other cells of our body are not being compromised as well. Okay, now how do we know if your autophagy genes are good or bad? Or in another word, if you have mutations in the genes of autophagy? Thanks to a human genome project, we are not able to check your genes for autophagy functionality and mutations as a part of the more comprehensive genetic profile. Since 2017, when nutrigenomic testing first was available for clinician and clinical use, I have been working with the company called Fegron, and it used to be called GX Sciences, and to use their platform for testing. And I absolutely trust them and like them because they are very clinical. And when your genes are tested for autophagy, part of the test results could look like this. You see this, So this is that's the section, cross section. ATG stands for autophagy, and then this person got both mutated autophagy from mom and dad, meaning that the knobs on the washing machine are broken, and this one is half broken. And if this person didn't have any mutations, then the color would have been green and the signs would be negative and negative. But this is a real case. This patient came to me because she has had strong family history of breast cancer from mom's side. Almost every woman, that would be around 5 or 6 women, they got breast cancer. And my patient doesn't have BRCA genes, the actually clinical direct doom and gloom genes, correct? But then wanted to know what can she do to be proactive. And I needed to know basically I had to see where are her weaknesses, basically, and especially with the autophagy, that could be the driving factor in the direction of cancer, correct? And this was her result. She had also, from the dad side of the family, history of dementia and Alzheimer's. And this is almost, I mean, this is actually not almost, always when I have patients like this, yeah, I mean, these genes confirm their weaknesses that was driving them, that the family most probably to that direction, okay? So the knowledge of your genetic testing is very important. And I'm very dedicated to teach you the unique story of your genes and how they affect your health and possible tendency to different diseases. And it's easier to understand these concepts in small bites. And remember, your genes don't change. So once you learn it, you learned it. You know, so you don't have to keep like learning new things because the genes are not changing. And so that's why my patients are extremely smart and very receptive to getting educated and understand it. Medicine is changing, and thankfully we can now, through educating you about your individual genetic makeup, we can put you in a driver's seat to better health management. And always remember, know your genes, control your health.